Hi, and welcome to Care of the Sexual Assault Victim. This is a three-part session on the things that you need to do before, during, and after the collection of evidence for a sexual assault victim. So let's start with talking about the implication of sexual violence in the state of Connecticut. So if you didn't know, 1 out of 2 women and 1 out of 5 men have experienced sexual violence other than rape in their lifetimes, with an estimated cost of sexual violence around $5,700, which includes lost wages, medical costs based on emergency visits. So the victims can range from all nationalities. 48% are white, 33 Latino, 11 Black, 1% Asian. And not only do they suffer physically and emotionally, but those implications will carry them, and they're more likely to have experience poor physical health, and experience poor mental health. Victims or students that experience sexual violence were more likely to feel sad or hopeless, miss school, inflict self-harm, attempt suicide, and likely to experience bullying. So it is a significant problem that affects a lot of people here in Connecticut. So our job is to care for the victim of sexual assault with the utmost care. One of the resources that you have available to you is called the Technical Guidelines, and this is a resource that's in print in our sexual assault cabinet, and it's also available to you on the internet. So for accurate specimen collection, it is essential that the examiners collect the information that may serve as evidence in legal proceedings. So if you take this website, you can put it into your browser, and you do have to look for it in education website. Technical guidelines. This is for healthcare response to victims of sexual assault. And here's the link, so you can click on this link and it will download the technical guidelines for you. So bring the computer into the room with you for the collection of evidence, and anytime you're stuck or you're not sure, there is plenty of information for every step that you need. It also has algorithms that are helpful. I'm just scrolling down really quickly so that you can see. For example, it has the forms so that you can see ahead of time the things that you will ask the patient or do during the examination. And I'm looking for page 79, which is one of the algorithms for care. So I will scroll and try to find it. Oh, here it is. So it's page 79 in the technical guidelines. And for example, this is for patients with strangulation injuries. So you can kind of see this algorithm of, if the patient has these symptoms, then what is recommended. If they don't, then what's the ideal discharge plan for them. So very, very good resource. And remember that you'll have the link in our education website. So the first thing that you want to do with a victim that comes in with sexual assault, you want to make sure that that patient is brought to a safe place. There are victims of sexual assault are trauma patients. So not only psychologically and physically, but you do need to treat them as trauma patients, because they may not know the extent of their injuries. 15 to 20% of victims are strangulated, and that's the reference of the algorithm that I showed you on page 79 of the technical guidelines. So they may present with symptoms, and you have to kind of figure out what those injuries what the injuries entail. So if they have like a hoarse voice or bruising on their neck, that might lead you to believe that they were choked, and they may or may not remember. Medical care always comes before evidence collection, so any imaging for their injuries, treatments to stabilize, pain control, that comes first before the collection of evidence. So this victim will be ESI 2 or 3 depending on the severity of their injuries, but at least a 3. And then all imaging must be done prior to the forensic exam, and the victim must be medically stable for the forensic exam because they need to participate during the exam. So they have to be fully awake, fully understand what every step entails. As far as costs goes, know that the victim cannot receive a bill for the collection of evidence. This will be billed to the Office of Victim Services, and they'll be the facility will be reimbursed. The victim's insurance may be responsible for any of the treatments of the injuries, say x-rays or stitches, but even so, the victim compensation program may be able to help them with some of these costs, especially if people if they don't have insurance. So that is definitely a resource available to them. So the nurse, after putting them in a safe place, will need to call the victim advocate. Okay, and this is the law. This is not optional. We have to call for every single victim. Okay, so the rape crisis that's closest to us is Milford. So we would call the office and let them know that there's a victim of sexual assault, and then they will come out, and if the victim doesn't want anybody there, they decline the advocate services, then that is perfectly their right, but we have to make the phone call. So the advocate is very helpful, not only a support system for the patient, but they're very helpful to the staff as well, because they're able to kind of lend a listening ear and hold patients' hands and just be a support system while you're kind of more focused on this evidence collection. They do have privileged communication by statute, meaning that they cannot be compelled to testify. So anything that they hear or see during the exam, basically they can't sit in court. If the victim's Spanish speaking or male, and they'd request an advocate that speaks Spanish or a male advocate, then we can request that when we make the initial phone call. But if it's a language issue, they cannot interpret for us for the exam, so we would have to have Marty to do the interpretation. They can bring clothes to the patient because we'll be collecting their clothes as evidence, so they could bring them a set of clothes. They can help the patient to the restroom. They cannot be part of the chain of custody, so again, it's the more of them being a support system for the victim. The advocate can offer the hospital support, confidential crisis counseling, information regarding choices. They can accompany the victim to police or court sessions, and they can give the victim food and drink after the oral swab is completed. In regard to law enforcement, you can call the police from the town that the assault happened if the victim wants to report it. If the victim doesn't want to report it, but they still want to do a evidence collection, then that's fine too. You would have to call, in our case, because we're in Derby, Derby Police. So as far as which department to call, it depends on where the assault happened. So if the assault happened in New Haven, we'd have to call New Haven Police. If the victim does not recall where the assault happened, then we would call Derby Police. If it's out of state, we'd call Derby Police. And if they're keeping it anonymous, we'd also call Derby Police to pick up the collection of evidence. If they are reporting, the police officer, law enforcement will need, and they need to talk to the patient prior to the exam beginning. And that may be because there's a crime scene to protect, or there's a suspect to look for, or the need to collect clothing from residents. But this interview or this interaction should be quick, should not be any more than 10 to 15 minutes. This is not the time for the police to do their interview or to do the official police report. This is in the ER is not a good time. This can be done days later. And also, remember that the victim is just had a traumatic experience and they're going to have to tell you the story as well. So it's just not appropriate for them to have to say the same thing or relive the same thing, especially at this moment in the ER. So if the victim is under arrest, they also have the right to have privacy during the exam, so the police cannot be present. Even if the patient's handcuffed to the bed, the police would have to be outside of the room. Any items of clothing is considered evidence, and the RN must maintain a chain of custody. So if we need to have the patient changed to examine any initial injuries or stabilize the victim, we would carefully collect those clothes, put them in the paper bags, in the extra paper bags that are in the cabinet, and staple them shut and keep them with you so that we know that they're not being tampered with. We don't collect coats or shoes. The other thing that you want to keep in mind is that we can't give any food or water, food or drink until the oral swab is collected. And because it's one of the first envelopes, it's nice because if the patient is hungry, as long as you get through that first envelope, then they can have something to eat or drink. So they don't have to starve for the, 3 to 5 hour that it lasts to do this evidence collection. And if the patient must urinate, you can collect that urine and keep it with you, again, to maintain that chain of custody. And then you will put them in the appropriate receptacles. Ask them not to wipe because you don't want them to wipe away any DNA. So if they can help it, don't wipe at all. But if they must, a gentle dab would be best. As far as us being mandatory reporters, any victim that's under 18, we would have to call DCF. Any victim over 60, and for Connecticut, anybody over 60 years old is considered elderly. So we would have to call the protective services for the elderly. Any patient from a nursing home, we'd have to have case management get involved and help us with that reporting. And then any adult with developmental disabilities, we'd have to call the Office of Protection and Advocacy for Persons with Disabilities. And all of these phone numbers are available as a reference in the education website. Okay, so that is a lot to do even before you've opened the evidence collection box. But all, very important things. So now if you know that you're going to collect evidence and do the kits, you can start preparing the room, which means anybody that's with the victim, be it a parent, a sister, best friend, whomever, they need to know that anything they see or hear during this exam they can be subpoenaed for and have to testify. So as long as they understand that, it's okay for them to stay in the room. Remember, the advocate cannot be subpoenaed. You want to warn them that it will take anywhere from 3 to 5 hours to complete the exam, which for you as a nurse, you want to prepare for that. So whatever you need to do, get yourself something to eat, make sure you go to the restroom, make your phone calls, whatever you need to do. Because you will be a one-to-one with that patient for the entire time that that kit is open. As far as the equipment that you will need, I have most of these things in the cabinet in room 22. So you want the collection of evidence kits, which is the Connecticut 400A. You want the Connecticut 100B kit. You want measuring tapes, and that's to measure any injuries, bruising, anything on the body that may be related to the sexual assault. You want extra swabs, and this is for collecting extra evidence of secretions or touch DNA. You only get so many swabs in the kit, so if there's multiple areas, you'll have to use hospital stock for that. You can print stickers for labeling because you do need to label every single envelope that's in the kit. So to help you with that and offset some of the work that entails, you can just pre-print a bunch of stickers and have them ready for each envelope. You'll need saline syringes, and this is to swab some of the for some of the swabs require them to be moistened, and you can also use the saline to wet the envelopes to seal it, because you would not want to lick the envelopes to seal. So that's a really good use of your saline wipes, and you can use a 4x4 dressing just to wet that envelope and seal them shut. You'll need boxes of gloves because you will have to change them in between each envelope, so you need enough gloves. You need a clean, disinfected work area. You need extra paper for the history. They only give you 3 pages, so depending on how long the story is or how complex the story is, you want enough paper to write on. You'll need masks. You'll need to wipe down your pen and stethoscopes and glasses and anything that you may have your own DNA on that you don't want to have get into the kit. You will need a GYN setup. For this purpose, we will not use any lubricants. And you also want a portable phone or a phone in the room in case you need to call for help, or you need extra supplies, something you forgot, you can't leave the room. So they will have to bring things to you, and you could also give the physician a heads up of when it's time for them to come in for their portion of the exam. You'll need foam cups for drying your swabs. You'll need disposable gowns and bonnets to cover yourself. Disinfectant wipes, light source so that you can see you can see injuries clearly, and large brown paper bags for clothing, a stapler to seal those bags shut, and then there's also exam and process signs for the door so that you can hang that on the door and people are not just barging in to get something from the room. So the evidence collection kits, you will there's 2 of them. The first one is the Connecticut 100B, and this is the sexual assault evidence collection kit. It can be collected up to 120 hours or 5 days from the time of the assault. It's only designed for victims 13 and older. So if you have a child that's under 13, you may need to send them to a facility that is better equipped to handle sexual assaults. They must all be done with consent. The Connecticut 400A is a smaller box, and this is the toxicology screen evidence collection kit, which consists of blood and urine. So the blood can be collected for up to 28 hours from the assault, and urine up to 120 hours from time of the assault. It must be done if the patient doesn't recall the event. So if they think they might have been drugged, then it's definitely important to do it. It must be done with consent as well. The blood and urine cannot be tested for ETOH more than 24 hours from the incident. Urine, the patient may not be able to hold it, so if they need to use a bathroom as soon as they come into the ER or shortly or thereafter, that's fine. Allow them to urinate, but then you would have to keep that urine in your chain of custody, so that you have to basically keep it with you, put it in a bag, in a patient belonging bag, and keep it on your person until you can label it and make sure that it's not out of your possession at any time. So the RN will collect the evidence, and the physician will do the physical and the speculum exam. In regards to photography, photographs should only be taken by knowledgeable photographers, preferably by law enforcement with appropriate equipment. Any images of general area should not be taken unless a patient provides a written consent to them. We do not take pictures for evidence. Griffin ED staff does not take pictures. We don't have a camera that could house and keep images secured, so it is not part of the evidence collection for us. If the victim wants to take their own pictures or have their support person take pictures of injuries, that is their business. They can do that. Now, the medical forensic exam consists of, first and foremost, the consent form, obtaining the history of what happened, the head-to-toe assessment for assault-related injuries and evidence collection, and then prophylactic treatment for sexual transmitted infections and emergency contraception, and then a discharge and follow-up. The consent is for victims 13 and older, and they must give consent themselves. The parents cannot consent for them against their will. So for example, if you have a 14-year-old who is sleeping with their 17-year-old boyfriend, and the mom drags them in to have an evidence collection kit done, unless that 14-year-old alleges that they're being sexually assaulted, they cannot have an evidence collection kit done in order for parents to, have evidence to charge the 17-year-old. That it's not what this kit is for. So currently, parents need to consent as well. So if the victim consents, the parents consent, but that is a law that recently got updated, that the victim, the child victim, can consent and they don't need the parents' consent in order to have a kit done. In this case, DCF would be involved, and they could also help guide, what can happen. This kit does not fall under implied consent. It is not limb or life-saving, so it is not required. It is not required for us to be able to treat the victim and care for injuries or any of that. The kit is strictly evidence collection. The consent must be read verbatim to the victim, and I will show you the consent. And the patient must be awake, oriented, and able to participate in collecting of the evidence. So unconscious patients cannot give consent. If they don't want to make a police report, that's fine. They need to know that the kit can be held anonymously for 5 years in the police station in case they change their minds. And then any discoverable evidence that can be used against them in a court of law, such as history of drug use or sexually transmitted infections. So lawyers will use that as a judge of character if the victim uses recreational drugs or has previous STIs. It can be used against their character judgment. So just the victim just needs to know about that. So let's do a little quiz as to, can this victim have a collection of evidence kit done? This is a 90-year-old female with advanced dementia that was sexually assaulted by a staff member. So if you can press pause here and think about the answer, and then when you're ready, come back. So if you guessed that the victim in this case cannot have a collection kit done, you are correct. A person with advanced dementia doesn't have the ability to consent for this test. They need to be completely alert and oriented and understand, because they have to give you a history of what happened. And in this case, this person unfortunately cannot do that. Okay, the next victim is a 25-year-old female who was sexually assaulted and is intoxicated and very sleepy. So go ahead and think of your answer and press pause. So if you said that this victim cannot have a collection of evidence done, you're correct. Because they are currently intoxicated and very sleepy, the evidence collection will have to wait if if that's what the victim wants to have done. But it cannot be done while they're intoxicated and sleepy. The next victim is a 30-year-old female who was sexually assaulted 6 hours ago, is very tearful but answering questions appropriately. So go ahead and think of your answer and press pause. Now, if you said that this victim can have a collection of evidence, you're correct. As long as they sign the consent form and understand the evidence collection, they can have a kit done. Okay, the next victim is a 10-year-old male who was assaulted by a family member. So go ahead and think of your answer, press pause. Now, if you said that we cannot do a collection of evidence, you're correct. This child must go to a facility that is specialized to deal with sexual assault children. The kit is designed for 13 and over. Okay, so this is a consent form and it's one page, so you will read the consent to the patient word for word. So the patient will put their name in there and then consent to allow, and then you put your name in there, the nurse's name that's going to do the exam, and any assistants who conduct a physical examination for the purpose of identifying and treating injury and collecting evidence to a sexual assault. This examination has been fully explained to me. I understand the nature of the examination and that the information gathered may be used in a court of law. If I choose to report this crime to law enforcement, I understand this examination may include clinical observation of the presence of injury and the collection of specimens for laboratory analysis, including testing for pregnancy and sexually transmitted infections, and that the examiner may provide me with medications to prevent sexually transmitted infections or pregnancy. I understand that I can stop the examination at any time or withdraw my consent to any portion of the examination or to any evidence collection procedures at any time. So this is important for you as a reminder that the patient can decline any envelope, any step of the evidence collection, or stop the exam altogether if it's just too traumatic and they're too emotional to go on. The next paragraph is, I understand that I am not required to report the sexual assault to law enforcement at this time or at any other time to have a exam and evidence collected, or to have the examination and medical care paid for by the Connecticut Office of Victim Services. If I do not immediately report the assault to law enforcement, I understand that the evidence collected will be held up to 5 years, during which time the evidence will be identified by a control number, not by my name. If I decide to report to law enforcement after 5 years following the assault, I understand that the evidence collected during the exam may no longer be available for use in prosecution. So if the victim does choose to put anonymous, make this anonymous, the way we identify it is you'll put Griffin and the date. And that way, if the victim does make a complaint anytime within those 5 years, the kit can be tracked back to that person. The next part is, I understand that I have the right to speak to a certified sexual assault advocate and to have the sexual assault advocate present during the examination if I choose. I understand that if the hospital has not called for a sexual assault advocate, I can request that one be contacted immediately. I understand that the services of the sexual assault advocate are confidential and free of charge. Okay, remember this is not optional. We have to call for every single case. I understand that the cost of the sexual assault medical examination and evidence collection, including the costs for pregnancy tests, tests for sexually transmitted infections, and for any medications to prevent sexually transmitted infections or pregnancy that I may be given, will be paid for by OVS. I understand that I am not required to report the sexual assault to law enforcement to have the examination paid for by OVS when the evidence is collected. I understand that the hospital will not bill me or my insurance for these costs. I authorize Griffin Hospital to send billing information to OVS to obtain payment. I also understand that in the event that I have physical injuries requiring medical treatment beyond the scope of the sexual assault examination, that the hospital will bill me or my insurance company, if any, for the cost of any additional medical treatment. If I receive a bill that I have any questions about, I can call OVS or an advocate with the Connecticut Alliance to End Sexual Violence. I understand that I may be eligible for financial assistance for any unreimbursed medical costs from the Office of Victim Services. And this is a number. Call OVS at 1-800-286-7347 for more information. So then the patient will sign and date it. You will put the control number of the kit, and then you can proceed to the rest. The next part is obtaining the history. Now this is really important because this will help you figure out where you need to collect your evidence. So what you're going to do is you're going to obtain a verbatim account of the assault. So you're going to treat every case as a real case. You're not here to judge or have your opinion as to is this case real or not, because you don't want that reflected in your documentation. So anything that the patient states, you're going to put in quotes. So as the patient tells you the story, you're literally going to write word for word what they're saying, put it in quotes. Do not use patient alleges or alleged sexual assault, as this creates doubt. You may need to take breaks during this story portion because it could be very emotional for the victim. I mean, they're recalling a traumatic event, and you're also handwriting everything that they're saying. So you may need to tell the victim, I need you to just stop for 1 second so that I can catch up on my writing and then go on. So it's very much two ways. You may need to take breaks, they may need to take breaks during this story telling portion. Then it'll also provide you a guide to the assessment and evidence collection. So if the victim tells you that they were touched in certain places or kissed in certain places, then you know that those are the places where you may need to swab for touch DNA or secretions. Word choice is important. You want to be neutral and unbiased. You want to use declined, not refused. You want to use the term victim. Make sure that your writing is legible. Spelling does matter, and a lawyer will turn this against you for like your professionalism. Like if you don't spell things correctly, they may question your ability or your professionalism. So make sure that if you're stuck on a word, you have your computer there, so just Google it for the spelling. You want to place lines through and initial and date pages or sections that are not being used. And then the paper documentation must be completed and scanned into the medical records, which for us, we put the yellow forms in the kit. And because they're carbon copies, then we'll put the other ones in the medical records and they'll scan them in. And these are audited for signatures and dates. So then is your head to toe assessment. So based on the history, you're going to look for your injuries, scratches, abrasion, cuts, bruises, tenderness. You have your tape measures so you can measure all of these injuries and use a light source. And in the paper forms, there's drawings of a body so that you can identify, okay, injury here, and put a line to it. Okay, so the first step, or step one, or the first envelope, is the known blood sample. So this will be done alongside your Connecticut 400A kit. And the Connecticut 400A kit is a small little box, and it has a urine cup and blood tubes. So you're going to draw those first, the small kit first. And then you're going to draw envelope number one, or step one, in the Connecticut 100B. And then any other labs that need to be drawn at this time, you'll draw third. And the steps are also written in each envelope, so in case you need a refresher, it's there. And this is why it also takes a long time to do this evidence collection, because it's not something we do every day. So we need to read carefully the instructions for each step. So here are your foam cups that you'll use for drawing your swabs, and I've made labels for you so that you could just put them on the cups and not have to handwrite them. And you can see that on top of the cups there's 4 holes, so each set of swabs has 2 Q-tips in them. So you'll put 2 for the first set and then 2 for the second set and allow them to dry here. Once you're ready to proceed, you're going to change your gloves, make sure your patient's okay to move on. Remember that this is a full participation from the victim, so they have to be okay with moving on to the next step. The next step is the oral swab and smear. And what is included in this envelope is 2 sets of swabs, and then there is 1 glass smear. So one of these sets will be smeared onto this glass, and you have a little pencil here so that on the frosted side of the glass you can write the patient's initials and the date and oral as the location of these swabs. And then once they're dried, they go into these little boxes. So you'll have to put together these little boxes that are flat initially in the envelope. So you'll build them and then put the swabs in there once they are dried. Okay, so in order to collect your oral swabs, what you're going to do is you're going to take 2 swabs at a time, and you're going to gently rotate them in inside the gums and the cheek. So you want to go on the upper gums and the lower gums and just rotate those swabs as much as you can. And you're going to do that twice. So the first one you're going to take, and then you're going to place them on your glass. So as you can see here in the example, you're going to take both swabs and gently rotate them one time on the glass. What you don't want to do is just smear this back and forth like this. That is not what you want, okay? You want to do the first example of this just gentle rotating. You basically have DNA on these swabs that you want to capture on this, slide. So what you're doing is you're covering as much surface area with those slides versus just the tip of the Q-tip on the glass is not effective. So then you're going to take those swabs, you're going to take the first set and you're going to put them in your cup to dry, and then you're going to take your second set and you're going to put them in your cup to dry. Then you're going to change your gloves, you're going to make sure your patient's okay to move on, and you'll proceed to step number 3, which is the collecting of the clothes. Now, if you can see that all of this writing here on each envelope, it's instructions of what you do, it's step by step. So one of the things that is helpful when you're ready to get your patient undressed is if you put a sheet down on the floor, you're going to take this paper, which is in step 4 of your kit, and you're going to open it up and you're going to put it on the sheet. Then you're going to have your patient stand on this sheet, and they'll, one clothing item at a time, will take it off and you will put it in the designated bags. Okay, so you have a larger bag for clothing, a smaller bag, and then a smaller bag even than that for undergarments. We do not collect shoes or coats, okay? And the patient can also decline to give any clothes. So the patient's going to undress on this paper, and the idea behind it is that if let's say they've been assaulted outdoors, on grass or on the ground, there may be debris that is like stuck to clothes that once they start to remove may fall down, and you don't want them to hit the floor. So you want them to kind of collect on this paper, and then once the patient is finished undressing, you can have them put on a hospital gown, and then you can nicely and neatly fold this paper back up, and you will put it in step 4's envelope. All of these bags should be, if any of these clothes are wet, they should be allowed to dry before you put them, dry as much as possible before putting them in the bags. And then that's where your stapler comes in handy, because you can staple close the bags so that you know that there's not going to be any opening or closing or tampering with any of this clothes. And then you change your gloves and make sure your patient's okay to move on, and then go on to step 4. So basically step 4 you already did. You're just going to close up that paper and put it in step 4's envelope. And you'll notice that every envelope has a statement on the bottom that says, was sample collected, yes or no? And if no, state if the patient declined or the other reason. So that's your opportunity to put in whatever reason this step was not done. Then you change your gloves, make sure your patient's okay to move on, And then you're going to go to step number 5. So this envelope is for fingernail swabbing and clipping. If the nails are too short, then you could write nails are too short to clip, but you'll still want to get a swab from underneath the nails. So the idea being, if there was any resistance, any fighting back, the patient may, or the victim may have scratched the perpetrator, so there may be some DNA under the fingernails. So you're going to take your saline, you're going to wet that swab, and then you're going to swab the leading edge and underside of each fingernail from hand 1, and inside of this envelope you have a piece of paper just like the closed paper that you will unfold, and one of them is for left hand and the other one is for right hand. And then you will take those swabs and allow them to air dry. And then if there is nails to clip, you can clip them. Again, that is in the event that there's any skin evidence under those or on the nails, they can retrieve them. Okay, so you'll let the nail fall on the paper, and then you'll fold it back up and put it in the envelope. Then you change your gloves, make sure your patient's okay to move on. The next evidence collection is the dried secretion specimen. Okay, so this is depending on your story. You may be able to, or in your physical exam, you may see dried secretions. So you're going to moisten the swab, and you're lightly going to swab the dried secretion using 2 swabs simultaneously. So just like you put the DNA on the glass, very gentle and in one direction, rotating those swabs. That's the same way you're going to collect your DNA from any dried secretion. Because what you want is you want to capture that dried secretion, but not press so hard that you're now taking the patient's DNA on the swab. So you may have more than one dried secretion, and that's where the extra hospital stock of swabs comes into play. And you can just indicate in the back of the envelope, you see the drawing of the body here. You can indicate where on the body you obtain the swabs. So you would just number them. Swab 1 is from here, swab 2 is from here. And then that way there's no confusion as to where that secretion came from. And then you're going to label each swab specimen, and you're going to allow it to air dry. Then you're going to change your gloves, make sure your patient's okay to move on. Step 7 is touch DNA. Again, this is where your story comes in handy, so that you know where your target places may be for touch DNA. So you're going to moisten the swabs and very lightly, again, swab the dried secretion using the 2 swabs simultaneously, just like you saw on the example of the glass. If more than one touch DNA is needed, you can use additional swab packets from the hospital stock. And then you can save the swab packages for storage of the specimen. And then you're going to label each swab specimen and air dry. So same thing, here's another picture that you could number and identify which swab is from where. And then you'll allow that to air dry. Next, you're going to change your gloves, make sure your patient's okay to move on. So the next one is the pubic hair combing. So back in 2016, the commission omitted pulling hair. We don't need to pull hair anymore. So if you've done this for years, you'll notice that there's no tweezers in this envelope anymore. So what you want to do is this piece of paper right here, you're going to open it up, unfold it, and you're going to place it under the patient's buttock. And what you're going to do is you're just going to gently comb through the pubic area, even if it's shaving, allowing any loose hairs or other trace material to fall on the envelope. Okay, so the idea is that there may be the offender's pubic hair possibly on the the victim's pubic region. Always good to catch your spelling mistakes. And then you're going to change your gloves and make sure your patient's okay, and then move on. The next step is the genital swab. So here you're going to moisten the swab slightly, and then you're going to lightly swab in the order of the envelope. So the instructions are in the back, so you'll be able to see where 1, 2, and 3 is of where you should be swabbing. And it's both directions for females and males. And then you're going to allow those to air dry. Change your gloves, make sure your patient's okay to move on. And then step 10 is the vaginal swab and smear. So this is the part where you'll need your physician to come in and they will do this portion. So just like the oral envelope, this envelope also has a glass smear. So you have your pencil from that step so that you can place the patient's initial, date, and vaginal on the smear on the frosted side of the glass. And then the provider will swab the posterior fornix below the cervix using the 2 swabs. You're not going to moisten these before. You're not going to use any lubricant. And then you'll prepare the smear just like the one for the oral. And then you'll allow those to dry. You'll change your gloves, make sure your patient's okay to move on. And then the step 11 is the anal swab and smear. This one you're going to moisten the swabs and then gently swab the inside of the anal canal to the depth of the cotton swab, which is about 1/2 inch or so. And then you're going to allow it to air dry. Now, again, remember that the victim can decline any part of the exam if there is no part of the story where there was anal penetration, then it makes sense if they don't want to have this part done. But if they don't remember, then you just explain to them what the collection entails, okay? And then they will decide whether they want to have it done or not. Change your gloves so that you can move on to step 12. Step 12 is collecting any other evidence, maybe any moist evidence, so you have extra bags to put things in, extra envelopes. You can use the hospital stock swabs to include in here. And then you can change your gloves. And that is the end of the evidence collection. So even though I explained to you each envelope pretty quickly, there's a lot of instructions on the envelope, so you want to make sure that you spend the time and read it carefully so that you're not missing anything. And just reassuring your patient. I mean, it's a very long, tedious evidence collection, so you just have to be patient and know that you're doing a good job. So once you're done with your evidence collection, you'll put everything in the box, and then there is 2 red labels, stickers that you will put on both sides, on 2 sides of the box, and you will put your initials in this line here, and that is to prove that this kit has not been tampered with until it gets to the forensic lab. The third part is the aftercare once the evidence collection is complete. So once the kit is ready to be sealed closed, there is stickers inside for you to seal the edges of the box and put your initials on. And then you will have the police, again from the town that the assault happened, come and pick it up. If the patient wants to keep it anonymous, then you will just put Griffin and the date on the as the identifier, and you will give it to the police without disclosing the patient's identity. Okay. The anonymous kits are not examined unless a complaint is filed, so they will sit in a police station until a complaint is filed. If they say they will report at a later date, you're going to submit that kit as anonymous. And the kit must remain with the nurse at all times. You must carry it with you and hold on to it until you hand it over to the police officer. So you could put the box in a patient belonging bag and just hang it on your shoulder. Do not leave it anywhere. Do not take it out of your sight until that police officer comes to pick it up. And on the box itself, you will write who you are then handing it over to. Okay? As far as the treatment for prophylactic STIs and emergency contraception, this is going to include treating the victim with ceftriaxone 250 IM for gonorrhea, azithromycin 1 gram for chlamydia, and metronidazole, which is your flagyl, for trichomonas. If they have alcohol on board, this will make them sick, so make sure that they've eaten something, so that they don't throw up. You can also do tinidazole 2 grams orally. And then for emergency contraception, there's Plan B, which is over the counter, and Ella. Prescriptions are not considered part of the reimbursed hospital cost. And it's important for you to know that Plan B is not effective if the female is over 165 pounds. So they may need a prescription for Ella because Ella is not BMI dependent. But this one you do need a prescription for. And then for discharge, you want to make sure that the victim has a safe place to go and that they get the discharge papers that come in the kit, in the Connecticut 100 kit. They need follow-up with medical provider in 2 weeks. They need advocacy follow-up, which the advocate would give them all their contact information. And then the police statement, if applicable, they will go and do that. Now, we need to account for each and every Connecticut 100B that we use. So what you're going to do is you're going to go onto this. So once you follow that link, it is a UPS trackpad basically, and this is where you're going to log the use of that kit. Now the username is Griffin ED and password is Griffin1. And it brings you to these options. So you're going to click on deliver, and you're going to put the kit number in here and then answer all the questions that it requires. Now it's going to ask you what did you use this exam for, this kit for. This one is for an exam. So I have a kit for training purposes. I had to log that in here as training so that that kit is accounted for, that they know that that kit is not sitting in a police station somewhere. Okay, and then you just follow all the instructions you'll put in, and then you're going to add kit, and the next screen will give you an option to deliver this kit, and then it's accounted for. And all the steps are in the ED website. Now, all of the instructions on how to do that properly are in the ED Education site, step by step, and we've had some kits not be processed completely, and that's because there's a very last step where I put here lastly you need to click deliver, and that actually sends, so you should see a thank you for using Connecticut Sexual Assault Kit Tracking Software as like the last thing on that UPS tracking site, and then that way you know you did it correctly. So thank you so much for watching this care of a sexual assault victim review. If you have any questions, suggestions, please let me know. We are currently able to send 2 people for a spring and a fall session up to Meriden to have a certification for sexual assault forensic examiner. Um, so hopefully we'll have more nurses in our department that are specially trained to collect this evidence. But in the meantime, any one of us nurses could collect and be asked to collect this kit. So don't be intimidated. Let me know if you have any questions or if you want to practice any part of the kit. I'm more than happy to show that to you as well. And thank you for participating. Have a good day.